Hi everyone, welcome to Axis Prescriptor. Today's discussion we are going to discuss about the frozen shoulder. Rather giving detailed introduction about the frozen shoulder, let me start with the clinical experience. Hopefully everyone treated frozen shoulder here and start share your experience. That will be a very beautiful point of starting according to me.
So I have seen many frozen shoulder cases, but main problem I faced is uh, I can't able to reduce their pain. Actually, every day they'll complain of pain. Pains reducing, but very difficult. And one more thing, every day at the session, the range of motion will be slightly improved.
Improve.
Patient feel better. But next day again they came to a clinic. Again it will be in the
With
previous
the same
stage.
restriction.
Same restriction. So patient also feel lots of depression. When it will cure, when it will cure.
First three session will be so beautiful. So
Yes,
first three session we see the improvements.
yes,
And patient also feel improvement. Patient will expectations goes higher. Oh, after coming
yes.
here, they do something. I feel better. Next
Mm.
day same, but it's okay. Next day same, but it's okay. Next day same, but it's okay. But after 10 days, 12 days,
Yes.
problem started getting more. Patient will not improve. What is next
Yeah.
from patient mind to start this question?
And what I've seen is like we have studied there are three stages. Like in that one particular stage will be persist for 1 year. Those things will be in mind. But the patient pain will be there for more than a year, but the pain will be still persisting. So at initial point of time, I was very confused in what stage they are exactly, what is happening inside. I don't know exact pathophysiology. So after that only we came to explore. We all will sit and study what is frozen shoulder, how is that arise.
When we couldn't able to treat one patient,
Yeah.
that really what is happening frozen shoulder? Is it frozen shoulder is really treatable or not treatable? Are we doing any mistakes? If we are
Yes.
doing any mistake, we can learn. That is how it starts.
Yes, yeah, yeah, of course. So that's how we started to learn this, and today we will explore.
Any physiotherapist, if we ask, which is a very one condition, you tell me that the very difficulty to treat, the patient will not improve. I hope every physiotherapist will say there is a frozen
Frozen
shoulder.
shoulder.
Blindly, they will say the frozen shoulder. What is the mystery behind the frozen shoulder? Why it is very tough to treat? So let's begin with the frozen shoulder. What is frozen shoulder according to you?
It is actually inflammatory disease. That's all. But inflammation of not only the capsule, bursa, and also other ligaments. Everything will go for inflammation. Synovium, everything. So basically, it is a synovial joint inflammation.
Synovial joint inflammation.
Yes.
Okay. So according to me, when it comes to shoulder pathology or shoulder pain, it has to come under these three terminology only. So sub-classification. Shoulder assessment is very easy, but we are feel that that's complicated because one of the most mobile joint in the body, considerably. Uh, Three classification. Any patient come with shoulder pain. First classification is stiff shoulder. Second one is unstable or loose shoulder. Third classification is weak or strong painful shoulders. The third classification is actually the rotator cuff lateral shoulder pain, subacromial impingements, subacromial pain. Those are the things comes under this classification. That is where it leads to heel sac lesion, slap lesion, dislocation, and other pathologies of the shoulder. First classification is stiff shoulder. Frozen shoulder comes under the classification of stiff shoulder. There is a lot of other stiff shoulder also. Severe fracture induced stiff shoulder, and immobilization leads to stiff shoulder. Tumor cell stiff shoulder, severe osteoarthritis in the shoulders, and very rare. That is also comes under the classification of stiff shoulder, and post-traumatic fracture. Just now we said. And when it comes to loose shoulder, that is called unstable shoulder. Instability, hypermobility by birth. There is high chance. These are the first of all, if the patient come and sit in front of us with a shoulder pain, we have to rule out stiff shoulder. If you immediately rule out, next is unstable shoulder or loose shoulder. If you rule out that, then the shoulder pathology definitely comes under the classification of weak or strong painful shoulder. Okay. Yeah, that's all. This is about the shoulder joint, basically classification. So, considerably, frozen shoulder comes under the classification of stiff
Stiff
shoulder.
shoulder.
Stiff shoulder.
I have a question. So you said it is an inflammatory condition of the synovial joint. So why it is called adhesive capsulitis? Why a special mention is made regarding the capsule alone?
Actually, I feel See, it is actually affecting other structures also. Ligaments, bursas also affect. So not only the capsule, but mainly it is affecting the capsule. That is why they're naming like adhesive capsulitis, and it can occur in some other joints also. So adhesive capsulitis is a common term, so we can use through any joint. Adhesive capsulitis of shoulder, adhesive capsulitis of hip, adhesive capsulitis ankle, like that. But if you take frozen shoulder means frozen shoulder of what already denotes the shoulder, right? So
Why there was a term called shoulder? Because synovial fluid or membrane was present in many joints, right, in human body. Synovial joints. Why shoulder alone?
But shoulder joint is the most mobile joint, right?
Why the hip joint also a ball and socket? There is more mobile
Comparatively,
joint.
the functional range also is more in shoulder joint, and also comparatively, the shoulder joint is most mobile joint.
Most mobile
Yeah.
joint. Comparatively, in all the human body, most mobile joint.
Synovial joint.
Mobile synovial joint. That is the only reason behind it, or
So
anything.
because of the demanding the mobility, it have more fibroblasts cells. That is a reason for.
So if the joint has to be more mobile, it requires a lot of fibroblast
Yeah.
cells. So shoulder has a lot of fibroblast
Blast
cells.
cells.
Okay. Okay.
So that's why it's more common in shoulder.
No.
actually these
yeah, correct.
fibroblasts
Makes sense, but not relatable.
because these fibroblasts will easily react with the inflammation. So
Okay.
generally, if you are having any inflammation in your body, fibroblast is the first cell will get activated for that inflammation.
Okay,
So
okay.
shoulder is having more fibroblast means any inflammation occurs specific to the shoulder or general in the body, shoulder fibroblast will easily react. So it will more prone for getting any inflammatory disease.
Okay.
One more thing, I feel like shoulder is a less stable joint, right? So at the rest time itself, capsule work of capsule is very higher. So generally, if any in the shoulder joint, capsule load is very high. So capsule is more prone for getting inflammation. For example, in the knee joint means cartilage, it's the most weight bearing joint, so cartilage work is more, so that is why osteoarthritis is more common in the knees. But when it comes to shoulder, capsule is working a lot, so capsule is more prone for getting inflammation. So that is why most commonly, frequently, most of the people are getting this frozen shoulder.
So my next question is: once one person got the frozen shoulder, how do you know the person got frozen shoulder? What are the risk factors of the frozen shoulder? What consequences he will face? But what are the risk factors of frozen shoulder? Who will get frozen shoulder? High risk of getting frozen shoulder.
To generalize, if we are speaking generally now, whatever the condition which induces inflammation will be a risk factor for
Can we name the condition that produce inflammation? 10, 5, 6 conditions.
diabetes,
Diabetes,
obesity,
obesity,
With
thyroid,
Yes.
I
And
flip it,
any
they will lip it,
cancer, breast cancer.
breast cancer,
sedentary lifestyle.
secondary lifestyle.
Yes.
Good. So anything which is causing increasing inflammation, that is considered to be a low grade inflammation for prolonged period of time in the body. That again I'm saying that ESR, CRP level is high, interleukin, hemorrhagic factor levels are so high for the prolonged period of time. Again I'm remembering that is my PG study too. The people who is inactive and people who is active. So my study is comparing the active individual versus inactive individual, which means who is taking a break in between the working hours, IT population, who is continuously working. And surprisingly, we found out the people who taking regular breaks and make themselves active, we found out the lower level of CRP, ESR, tumor necrotizing factor, interleukins. Them comparatively inactive individual, sedentary individuals. So that is, and again, one of the important risk factors of developing diabetes, developing hypertension, developing obesity. So these are the things, cardiovascular diseases, and so many things considerably. So sedentarism, one of the primary factor too for developing this inflammation. Inflammation is the one of the risk factor for developing frozen shoulder, step by step. So any other risk factor which you want to add here?
Women is more prone to have.
Women's more prone to have frozen shoulder. I think 1.6 to 4 times higher the risk of getting frozen shoulder compared to men. Is there any reason behind it?
So one reason I feel, usually this disease also called as a 50-year-older syndrome. So mostly above 40 only this disease will occur. So on that time, a female will go for a menopause stage. So estrogen level will be very less. So on that time, they're actually their body itself more prone for getting inflammation.
So anything comes to more risk of female, immediately you're doing less amount of testosterone. Yeah, that's the true reason they are unlucky. Estrogen reduction has happened post menopausal stage too. So considerably these are the factors blaming, because calcium deficiency will come immediately, bone density will goes down, osteoporosis also because of the same reason they have higher risk of developing. So muscle mass reduction also because of this reason. So many factors. So if you are watching this, you are a female or your mother, a sister, colleague, anyone, just ask them to do strength training. It's very, very, very important, because everyone is going to lose after 35. Whatever the capability you have, our metabolism and functional thing, everything is going to reduce. If your mom is 45 years old, if you are anyone in your home, you have a baby kid 2 years old, whoever, please make them do physically active and strength training. Compared to men, women are required more amount of strength training, and we need a strong nation. Kritika, I noticed when you were saying that's a 50-year-old syndrome. So yeah, I know the story behind it. There is a Japanese who named this the name of frozen shoulder itself 50-year-old disease. So why aged people will get more? Any reason behind it? 50 years plus. Yeah, average range to get affected is 45 to 65. 45 or 40 plus to 65. Why 50-year plus? That average mean value is more common. Why not younger people gets affected?
Usually, if the people with a young age means at least somewhat they'll be active and their cells, all the cellular function will be somewhat in a good state. So their anti-inflammatories will be good. So they won't more prone for getting this inflammatory disease. But when they get old, almost they'll be towards to sedentary lifestyle. So they are more prone for inflammatory disease.
So considerably, if this is a reason.
Yeah, and this is the main diagnostic feature also.
Okay.
After 40, 50 plus only, they'll get this disease.
So if,
Yes.
if person in front of your age is more than 40, 45 plus, having any comorbidities,
Yes.
inflammatory comorbidities are the diagnostic tool also,
Yes.
information to confirm that is a frozen shoulder. And my question is, so then that is the reason then in future young people also will get affected.
Yes,
Consider the
maybe
lifestyle
in
which
the
we have.
future. Yes.
Okay, another 50 for 30 years of researches maybe shows that 50-year-old syndromes can come back to 30-year-old syndrome. Maybe, may not be, we don't know. What we understand we are saying, but if any experts are watching this, they can correct us in the comment section. So that's all, or we can add any other risk factors.
So neurological conditions like
Okay.
stroke, Parkinsonism. So it's a more prone, but research is still going. Why it is Parkinsonism causes the frozen shoulder? Frozen shoulder causes the Parkinsonism. Still is
So it's unknown.
is unknown factor.
Maybe that's a risk factor.
Risk factor.
So people who have Parkinsonism, they are affected by frozen
Yeah,
shoulder.
frozen shoulder more commonly.
More. Okay.
So stroke is also like that, and the post-operative conditions like anywhere in the shoulder fracture
Okay,
cases.
shoulder fracture or some surgical cases.
Yeah, surgical cases. like
Arthroscopic
this.
surgical cases or
Yeah.
something. Fine.
Repeated
Okay.
injuries.
Repeated injuries, shoulder
because
injuries.
that will cause constant inflammation.
Okay.
in the shoulder.
Great.
Similarly, for OA, we have discussed the same.
Okay.
Ongoing inflammation, which is not settled, can be a risk factor for this. Similarly, is for frozen shoulder also.
If you're watching this video for the first time, don't worry. Already we uploaded the podcast of osteoarthritis detailed discussion. Click here to watch that video separately after watching this video. Okay. That's only normal, yeah. Okay.
But most of the persons and super healthy persons also get chances of frozen shoulder.
But that's very rare, right?
Yeah,
That's
very rare.
That is considered to be a.
Yeah, without any comorbidities, they can.
Okay. That is all idiopathic frozen
idiopathic
shoulder, but the
frozen
reason is unknown.
Yeah.
So far, no understanding.
Without
Because when I studied 10, 12 years back also, we didn't know that this diabetes is a risk factor. That's all. Apart from that, inflammation cause something we don't know. These are the current understanding of the research and understanding. Maybe in future they can come, but current understanding is inflammation is a risk factor. Inflammations are getting by these comorbidities. Comorbidities will get by sedentary lifestyle and poor lifestyle habits. So this we can interrelate. Also, healthy people also will get affected. If healthy people get affected, that is called idiopathic frozen shoulder, but that is very rare. Rare. Okay. And then why diabetes are more prone? Because we know, right, diabetes are increasing the risk factor of frozen shoulder 5 times more than the other comorbidities. Secondly, thyroid 2.7 times. But if the diabetes are more, then why diabetes? Anyone?
Well, it is because of advanced glycation end products.
Mm.
When we have a high level of blood glucose in our blood,
Mm.
so what it will do now, it will go and bind with the proteins wherever it is. So it will alter the function of protein. Here, particularly as we are speaking about the collagen. Collagen is the most common protein which is getting affected. So what this glycation end products will do now, it will stiffen the collagen. So that is another reason why we the collagen is stiffening and the entire shoulder joint is going for stiffening.
So the excessive glucose will binds to the shoulder joint proteins,
Yeah,
you told,
right.
the collagen, and it leads to stiffness.
Yeah, and as ma'am said, there are a lot of fibroblasts there. A lot of fibroblasts means lot of collagen will also be there. So more commonly, shoulder is getting affected.
So I like to mention one study here is that is published on 2017, which is very high prevalence of frozen shoulder in patients with type 1 diabetes in more than 45 years. Okay, duration of the long-term follow-up study, and they found out 59 comparison between prevalence between non-diabetic population and diabetic population, and they were found out 60 cases diagnosed as a frozen shoulder in the long-term follow-up. That is considered to be a 59% of the overall population they followed throughout the course of the study. 59% of the population got a frozen shoulder with diabetic. 0% in pain-free subject, sorry, diabetic-free subject. The people who doesn't see 73 diabetic-free population, 102 diabetes population, they follow for longer time, and they understood 59% diabetic patients are getting affected by frozen shoulder. 0% non-diabetic 73 people doesn't get affected by frozen shoulder. So this study published in 2017. So we'll also mention this study here. You can go back and read that for further follow-up. So what is next after that risk factor? What patient feels? What was the patient feels? Because we know the stages of the frozen shoulder. What are the stages of the frozen shoulder?
Actually, it start with the pain.
Let's start
First
with the
stage
pain.
will be the pain.
So how
Patient
many
will-
stages are there in that frozen shoulder?
Actually, there are three main stages. Main stage will be three. In some studies, it shows four, but main is three. First stage, usually a patient will have pain, more pain, shoulder pain. And then second stage, gradually the pain will lead to stiffness. And finally, in the third stage, automatically the condition will be resolved.
Resolved.
Yes.
Okay, then we'll answer each of the stage why. Then why first stage is pain, night pain. Pain will be more. There is no stiffness. How long will be the duration?
There is no exact duration for the each stages. Okay, according to the associated conditions, the duration will differ. So the pain, the reason for the pain is that, as I said, there will be lot of fibroblast cells. So when there is inflammation is induced in that, so there will be more neurogenesis and angiogenesis taking place in that joint. So normally
Which
our
means
capsule
new,
is
now supply high amount of
blood
supply
supply.
will happen on that joint.
Yes.
Okay.
So normally our capsules don't have enough blood supply and nerve supply.
Normally it doesn't have much doubt.
Yeah,
very less.
very less amount only. But as the inflammation is there, our brain, our body will stimulate that there is an inflammation taking place. So there will be lot of neurogenesis, angiogenesis new to it. So because of that, the substance P, neurotransmitter, right? It's a pain transmitter, right? So that will be induced to that particular joint. That's the
Because of
reason.
inflammation starts at that time.
Because inflammation and we have neurogenesis, right? So because of that, the substance P will be generated more in that particular
But patient
joint.
complains mostly night pain, right? This process occurs, then why night pain is more? And also according to our experience and my experience, patient complains of pain at the midnight region. Why?
That's no, daytime also they feel pain, but more pain they feel on the night only. So because we know that, right, cortisol level is low at the midnight, so that time it they feels more pain.
Okay,
Because
how
cortisol is
cortisol
related. Cortisol is related to the pain is, so cortisol is anti-inflammatory hormone. So when it's a inflammation process reduced, when the cortisol is there. When the cortisol is not there in the night time, so that induces the inflammation more. That time the substance P may be more released. That time the patient induces the pain, feels more pain.
Okay. So moving forward to second stage. So there is no specific duration of each stage. Considerable understanding. Patient got pain, and slowly the neurogenesis has started happening, and the patient developed the pain more. One point of time, it was converted into stiffness. That is called the second stage. What was the reason? What was the transition period? What happens over there?
Yeah, actually, we have inflammation in the shoulder. So, first response will be this neurogenesis and angiogenesis. But once this neurogenesis, angiogenesis is taken for a long period of time, then this will be subsided. Then the inflammation will move into next stage. Next stage of inflammation is cell differentiation. That is, it leads to fibroblast proliferation. Second response of inflammation is fibroblast proliferation. But already shoulder joint we have excessive amount of fibroblast. But in the next stage it leads to another excessive amount of proliferation. So, but our body or our shoulder don't want this much fibroblast. So our brain will try to control this proliferation.
Why it doesn't want this much fibroblast? Because it's
It is an abnormal proliferation.
So, because of inflammation,
Yeah,
more
yes.
number of fibroblasts will
Yes.
come out. Okay.
So your body will your brain will try to control this. So what it leads means this excessive fibroblast will be converted as another cell, that is myofibroblast. Because anyhow we want to reduce this proliferation, but inflammation is there. We can't reduce the proliferation, but the formed cell will be converted as a myofibroblast. But for shoulder we need fibroblast. But all the fibroblast will be converted as a myofibroblast. So it leads to fibrosis
Shoulder
and stiffness.
loses its
Flexibility.
so
Yes.
leads to stiffness.
Stiffness.
Okay. Then nice transition happened. So how third stage it resolve its own, because stiffness then resolve it, thawing stage. Then how that transition period? How it will occur then?
In third stage, that is a thawing stage, we know that. So in that stage, the shoulder mobility is resolve its own. So particularly what happened in the shoulder joint when is the frozen shoulder. So it's the end of the inflammation period. So all the inflammation is gone. Like all the fibroblast cells is converted to the myofibrillars. The brain thinks okay, the inflammation period is completely over. So settle down. So what we will think, so all the myofibroblast cells is undergone to the apoptosis. That is a cell death. So if once all the myofibroblast is not there means, so it's we getting the mobility,
function
yeah,
of the
normal
shoulder.
function of the shoulder.
Okay.
So that is the reason why people with comorbidities like diabetes and all have ongoing inflammatory process. So it takes
The
longer
healing time
for,
is more for them.
So then, what is an average duration of this? Completely, it will get resolved on its own. Average, for example, I got affected with the frozen shoulder. So how long it takes to resolve its own? Average duration.
Usually 3.5 to 3 years, but it's not about the that particular condition. What the patients have because of the maybe diabetes I have, maybe because of the thyroid. So the comorbidities is there means the inflammation period is also takes longer. The healing time is also take longer.
And the thing is, we can't say with 3 years the pain will go off. So because for few people, one stage itself will be there for persist for 2 years. So within the next 1 year, the next 2 stage will not be crossed. So for again next 2 years, the second stage will be there. So likewise for each and every person, according to the comorbidities, the duration will differ.
The stages overlapping is there.
Yeah, overlap will be there. We can't just define it.
And we can prevent this frozen shoulder, but we can't prevent the stages. Once the first stage started, it has to be only in the third stage. We can't prevent like from second stage to directly the first stage and all the third stage. We can't able to shift the patient. It has to be ends in this. It has to cross the second stage, and finally it has to end only in the third stage.
So then, my biggest concern, if the frozen shoulder resolve on its own, then what is the treatment? What is the treatment? How to treat the frozen shoulder?
No, again, the frozen shoulder will resolve on its own, but it is not complete recovery. About only 40% of the people will go for complete recovery. The other 60% will have residual symptoms, functional limitations again. So for that, we need interventions to be done.
What are all the interventions to be done, and when?
And no, even though the range of motion got achieved, but almost 2 years they won't move their shoulder much. So all the muscle will go for a deconditioning. Anyhow, the range of motion achieved, but again the muscles, everything will be in the deconditioned state.
So, due to this, after 3.5 years, if in case the patient
Yes.
resolve on its own, also patient feels some discomfort in the shoulder because of the deconditioning. This process,
Yes.
process of completely recover of the frozen shoulder, they may not did some movement regularly. So, lifestyle management and making them active. So, what do you think about the pendular exercise and finger ladder exercise? So,
Sir,
because some popular opinion was there, whenever I go and take classes, if your clinic now urbanization, modern things and all comes, still if you go some rural area, if your clinic doesn't have that marine wheel, finger ladder, people will step into your clinic and they will think I come to some other different place and they'll go back because wax or marine wheel and finger ladder is one of the primary choice of treatment in frozen shoulder still in many clinical practice. So, what could be your advice for them to treat the frozen shoulder?
So what I feel is when a patient get a frozen shoulder, they will have lot of fear and anxiety in them. They know suddenly my shoulder is not working, but it's a gradual process. But it's the persistent of the pain and inflammation, the years of suffering.
Average diagnostic process itself takes
Takes-
9 months.
exactly.
Average
Yes.
9 months because we
Yes.
made that 9 month patient goes a lot of conflicts, concerns,
Exactly.
worry. Did anyone diagnose my shoulder? Because usually before 9 months the frozen shoulder as diagnosed as rotator cuff related shoulder pain. Some subacromial millimeter because that time stiffness will not be there because that is one of the primary diagnostic process. Meanwhile, we will diagnose as this tendon is gone, that tendon is gone, your shoulder is getting impinged. Patient has a lot of confusion, worries, and we give false hope also. 2 weeks treatment, 4 weeks treatment will make you better. That makes the patients more worried and depression. If the patient after developing stiffness and coming to you, how much communication skill you have, how much that you can make them patient understand is the key factor.
Yes.
Mainly.
Patient
Patient
education
education.
plays a major role in this.
Excellent.
That's an excellent treatment what we can offer.
So wait and see. So something you want to see.
No, you asked about the pendular exercise.
Correct.
So I feel like when in my college days also I also gave some pendular exercise to many patients, and generally shoulder exercise I feel it is not much needed. Main treatment is making the person active, and secondly you have to focus on the shoulder. But always in frozen shoulder means we'll focus more on the shoulder, only shoulder. And
So root cause is not because of the shoulder getting the
Yes.
problem, isolated problem. Whole body is the reason for the shoulder problem.
And
the
I
time.
feel we know the pathophysiology now.
Exactly.
Only because of the presence of myofibroblast, the mobility restriction is there. Even though you're giving pendular exercise or wand exercise, finger ladder, anything, the myofibroblast won't be changed. It will be in the
Until there is no myofibroblast in your shoulder, it will take time. So wait and see.
Yes.
That's one of the best treatment approach. And what is your opinion about mobilization?
Again, it's
Mobilization,
same. If you
Feel like
want,
we are hurting the
yes.
joint again and
Yes,
again.
actually, in the first stage, mobilization is contraindicated because it is a yes.
There are a lot of research evidences. I will explain one by one.
Because first stage patient will have excessive pain, and if you are giving any mobilization, again it will induce the pain. So you are actually triggering the inflammation. So again and again, new
Pain
angiogenesis
will increase more, pain
yeah.
will increase more, stiffness,
Yes.
early stiffness will start
Yes,
come.
actually.
Early stiffness will start come.
So mobilization is contraindicated, and even though in the second stage, mobilization is not needed actually.
Again, the same reason. Your
Yeah.
mobilization technique is not going to change the myofibroblast.
Myofibroblast, yes.
So, it is of no use.
It's not needed.
So I'll add some 2 studies here, which is published one study 2004, which is randomized control trial of 2 years follow-up. 2 years follow-up. Total number of 77 patients are divided. Frozen shoulder patients are divided into 2 groups for 2 years follow-up. One group is supervised neglect group. Second group is intensive physiotherapy rehabilitation group. So for 2 years, one group they did treated intensively, active exercise beyond pain threshold level, mobilization, manipulation of glenohumeral joint, home exercise, non-steroidal anti-inflammatory drug. And the supervised neglected group, only they educate about the patient natural history, how long it take to resolve on its own and everything, and supportive therapy like going for walking, exercise with the pain limit, like how can you move your arm, thoracic rotation exercise, mobility exercise within pain limit, some strengthening and activation exercise they did. And do you know the results is very surprisingly after 2 years, supervised neglected group was improved 89 percentage, 89 percentage normal to near normal function. Okay, and in that 64 percentage of the people got better within 12 months, within 12 months. But the treated with intensive physiotherapy group was 63% of people only get to normal to near normal function. And in that 63% of the people come to good function after 24 months, because of you treated intensively, you mobilized the joint intensively, you hurted more, so you delayed the natural history process actually. So if the frozen shoulder patient comes to you, non-treating is one of the best treatment you can give it to the patient. And another research evidence also I can add here, this is a 2 year to 27 year follow-up study, 2 years to 27-year follow-up study, the natural history of idiopathic frozen shoulder. It was published at 2011. They also have 3 group: untreated group, non-operative group, manipulation or mobilization group. 94 percentage of the people with 27 years of follow-up, 94% of people untreated groups got better. 91 percentage of the people non-operative group got better. Again 91% of the people is manipulation under anesthesia got better. Okay, so 3 group basically treated, untreated, non-operative treatment, along with that manipulation under anesthesia. So again untreated groups got much better than the treated group. So educating the patient about the problem is important factor here. And let me add more point. Yeah, so wait and see, physiotherapy, there is a step-by-step criteria. Maybe I will upload this picture in that slide. First step is wait and see. Then second is physiotherapy. Physiotherapy means it's not intensive aggressive physiotherapy who you just take wand and do 50 times every day beyond your pain threshold level, available pain threshold level, making them improve the physical activity, walking, cycling, and focusing more on the comorbidity which they have, taking care of that. And along with that, giving confidence, thoracic mobility exercise, whole body mobility exercise is the key factor. And then medication. Finally, the corticosteroid injection. Hydrodilation injection works better. If nothing works, the patient have more than 5-6 years of the problem, then you can go for surgery at the last. This is what it suggested. There is no evidence to support that actually that modalities will help. Electrotherapy, massage, first of all. Mobilization are recommended if you are doing. So not completely contraindicated. Mobilization was recommended if you are doing at second stage or third stage, not the first stage. Not the first stage. Okay. For improving range of motion and function, it's okay, but not at the first stage. Okay. If the person crossing third stage, stiffness also get better, then mobilization works better. Stretching also recommended in the same way according to research evidence. And strengthening exercise, there is no specific evidences there, but often include with the stretching and mobilization of later the second stage and third stage works better. So what is wait and see then? So we said the people wait and see is the best treatment. What is wait and see?
Again, here the patient education is important. For overall function, for overall treatment, if we are giving, they don't understand, okay, why they are not giving the particularly for shoulder, why I am restricting shoulder joint, why they are not giving the exercise for shoulder joint. So that's why we have to educate.
Explaining about the treatment options, why we are doing this is one of the important process in the wait and see, as well as listening to their concerns, answering their questions, and explaining the diagnosis and prognosis. As I said now, explaining the treatment option. If the patients are coping for this, contact for example 2 weeks once, 3 weeks once for telehealth, teleconsultation, or ask them to come 2 weeks once. But we do treatment for every week, 5 days, 6 days. It's not recommended at all. And ask them to implement by physical activity and everything we're on. Once the night pain is settled, patient ready for the treatment. Once the night pain is completely settled, then patient is ready for the treatment. After that, we can start the treatment weekly. Once we can ask them to come for a couple of more weeks, and we can guide them about the stretching. Stretching leads to more contraction. Mobilization leads to more contraction in painful stage. Once the night pain is settled, then we can go for the thing. Once the night pain settled, the patient started complaining of pain not in the shoulder joint, in the brachial region, because of the stiffness, which leads to overactivated deltoid and brachial muscles for the elevation of the shoulder joint. That is can be another important reason. Any more thing you want to add for the treatment aspect?
What I feel from the wait and see part is, if we can't help, at least don't harm.
Exactly.
So-
Can't help, then don't harm.
Harming doesn't only attributed to the mobilization and the releasing part, not only that, but the way we speak, the assurance we give. Usually we'll tell like we should assure the patient it is gonna settle, it is gonna be okay. But here the thing is, we should not give false hopes that it will be settling in 3 weeks, 4 weeks and all. We should explain clearly that it is gonna take time. Here the misdiagnosis also comes to play. If we are misdiagnosing it, then we'll give assurance like it will be settling soon. So diagnosis is also a mainstay here. So if we diagnose it as frozen shoulder, we should, as you said, we
Then
should explain.
here that's a point comes in my mind. How to diagnose the frozen shoulder? Main point of diagnose of frozen shoulder. How to diagnose?
So first thing, it is an inflammatory disease. So patient will have inflammatory kind of pain, that is night pain.
Night pain.
Night pain,
So
I
night pain
feel
is one of the
yes.
primary factor for the diagnosis.
Yes,
One.
yes. Then
Age, as we discussed in the risk factor,
yes.
age is more than 40 plus, 45 plus. One of the again considerable risk factor. Females
Yes.
having this complaint compared to males having an increased chance of getting frozen shoulder. And these are the three things you can helpful to diagnose before they are developing stiffness.
yes.
And ruling out the rotator cuff plays crucial role again. Okay, and then
Gradual onset.
gradual onset.
Frozen
Gradual
shoulder
onset.
is not going to happen in one day.
One day.
One day,
exactly,
yes.
Exactly.
Suddenly, so there will be no history of injury or overloading history. Any
Also, that is also one of the risk factor, right?
what?
No, like
No, sudden
pain.
Okay, sudden injury history, sudden acute
Yes.
onset. For example, they will, if you ask when it starts, they don't know.
Yes.
How it starts, they don't
They
know.
don't know.
And then
And both active and passive range of motion is affected.
both active
and
and
passive.
passive again when once the stiffness stage is developed.
Yes.
Once stiffness is developed. Before that, anything more point to add before that?
Before that, I feel any rotator cuff related shoulder pain, any muscle tear means definitely active range will be restricted, right?
Okay. Maybe at that time also we can correlate.
Yeah, in the early stage we can somewhat
So
diagnose.
active range of motion and passive range of motion both will be restricted. Any specific things was there?
Yeah.
Rotation of the
External rotation.
external rotation of the shoulder will be affected more.
How
Because
long? How much? For example, my 100-degree this external rotation come, 90-degree this external rotation come. It was restricted. Is considered a frozen
no,
shoulder.
actually 50%,
Ah.
more than
50%
50%
compared to
loss.
More than 50% of the external rotation restriction considered to be a maybe for example, along with that elevation in any plane, flexion or
Any two planes.
any two planes, sagittal or flexion plane, more than 30% of reduction in the range of motion considered to be a frozen shoulder. Frozen shoulder and stiff shoulder considered to be a stiff
Stiff
shoulder. And most importantly, one thing we missed to discuss here, that is a
X-ray.
normal X-ray.
Yeah, normal
Imaging
X-ray.
normal.
Because of any fracture or any rotator, normal X-ray, normal MRI will be not there. The MRI X-rays will be normal, then high chance of that is a stiff shoulder condition. Stiff shoulder condition. So to list out, and also isometric strength test will be pain free. Isometric test will be pain free because in muscle strength testing we are testing the mostly muscles and tendon. So capsular affection doesn't cause the muscle pain or tendon pain or something. So to summarize the thing to the audience, night pain,
Gradual onset.
gradual onset,
Age.
any risk factor, mainly we forgot to discuss diabetes or something, diabetes, thyroidism, cardiovascular disease, obesity, high lipid profile value, high amount of ESR, CRP, interleukin in your blood value,
Active and passive.
active passive range of motion will be restricted, more than 50%, and unable to take the hand behind the head, behind the back, and unable to take hand behind the back, and anything more to add?
More than 2 planes, the range of motion will be
Affected 30 degree.
Rotator cuff tear means which muscle is affected.
Accordingly.
That range will be affected. That plane only will affect.
Yeah, in these 2 planes will affect it. More than 2
almost
planes.
capsule,
And
entire capsule.
exactly, easy to rule out the rotator cuff related shoulder pain is ask the patient, be with the patient, ask them to lift, PA shoulder patient right side and rotator cuff related tear patient left side. Both of them lift like this only. But if you take the hands of the both of the patient, you can lift passively. PO shoulder patient hand doesn't move up. Rotator cuff tear patient move up. If that moves up, immediately rule out that is not a frozen shoulder. And can be due to rotator cuff lateral shoulder pain. Active passive range of motion, and X-ray is very, very important. Normal X-ray should be there. Normal X-ray should be there. Very good. So I want to add another important research paper which says that why normal X-ray is very important in frozen shoulder. Because another study which is published in 2019 of 350 shoulder X-ray with people with frozen shoulder. 350 people, they took an X-ray, they have frozen shoulder. Of this, 213 patients are females, which is 61% are females. In 97.7%, 342 people have normal X-ray. Out of 350 shoulder, 342, only 8 is abnormal shoulder. In that 8, 6 of them had a severe osteoarthritis in the shoulder joint, because that is also comes under fifth shoulder category. So it's easy to rule in or rule out. So diagnosis itself changed at the time. And one person have a fracture, one person have a tumor. So this is research reported. So normal X-ray, one of the important finding as well, along with the global range of motion reduction. External rotation, flexion or abduction. Okay. Also, progressively at later stage, internal rotation will also get affected. Great. I think we are done. Hopefully, this frozen shoulder podcast discussion really helpful to you. This is how we developed our clinical practice. Even though 3 years before you ask us, we don't know this much about the frozen shoulder. We started treating frozen shoulder, that was not improving. We found out what is next. We have started searching what is next, why it was not improving. So slowly we started getting an answer for it. That is how the process of learning. In this process of learning, there is a chance of doing some mistake. Definitely. This is a discussion learning. If you want to know anything more about the frozen shoulder, hope you got some more clarity. You can drop it in the comment section, your questions. Now, I'm damn sure, hopefully you understand why your frozen shoulder patient is not improved. How to diagnose, how to treat, you'll get more clarity, I feel. And thanks for watching till end. Hopefully and finally, happy learning. Bye.